I'm about to reveal the specific bedtime adjustments that allow your body to naturally drain excess fluid from your feet while you sleep, preventing that tight, heavy feeling in the morning. These are not general wellness tips. They are targeted mechanical and dietary changes that address the root cause of nocturnal fluid retention in older adults. If you ignore these signs, that swelling can begin to put dangerous pressure on your skin and vascular system, potentially leading to chronic issues that are much harder to treat later. I am Dr. James Williams, and I have spent years helping patients over the age of 60 manage circulation issues without immediately resorting to heavy medication. I have seen countless seniors suffer from swollen ankles simply because they were never taught how to position their bodies correctly at night or what to consume before bed. Many of my patients come to me frustrated because their standard diuretics are no longer working effectively, or they are tired of the constant bathroom trips that interrupt their sleep. What they often do not realize is that your doctor might have focused heavily on the chemistry of your blood while overlooking the physics of your bedroom routine, leaving you with incomplete advice that fails to solve the daily discomfort of edema. Swollen feet in the evening are a clear signal that your circulatory system is struggling to fight gravity throughout the day, and when you lay down, that fluid needs a clear path to return to the heart. If you wake up and your feet still feel heavy or look puffy, it indicates that your lymphatic system and veins failed to clear that backlog during the night, which is a significant health concern. This stagnation can eventually lead to skin ulcers, increased risk of infection, and permanent damage to the delicate valves in your leg veins. It is crucial to address this now with precise changes to your nightly routine, rather than waiting for the swelling to become permanent or painful. 1. The heart level elevation rule. You must elevate your legs specifically so that your ankles are physically higher than the level of your heart using a wedge pillow or a structured support system. It is not enough to simply place a soft pillow under your knees or calves. The angle must be sufficient to allow gravity to actively pull fluid out of the lower extremities and back towards the central circulation system for processing by the kidneys. When your feet are lower than or even level with your heart, the fluid that has accumulated during the day has no mechanical advantage to leave the tissues, leading to that stagnant, puffy feeling when you wake up. This specific positioning matters because it reverses the gravitational force that has been pulling fluid down into your ankles all day long. By creating a downward slope from your feet to your hips, you turn gravity into an ally that assists your veins in moving blood and lymph fluid efficiently. This reduces the workload on your vascular system during the night, allowing your body to recover and drain the excess water that causes stiffness. It is a simple mechanical fix, but it changes the fluid dynamics of your entire body while you rest. I recall a patient named Arthur who was 72 years old and struggled with persistent swelling despite taking his prescribed water pills religiously. He told me he was elevating his legs at night, but when I asked for details, he admitted he was just shoving a flat, squishy pillow under his feet, which usually fell off by midnight. He was making the mistake of thinking any elevation was good elevation, but his feet were still below his heart level. We switched him to a firm foam wedge that maintained a consistent 45-degree incline. Within 3 days, he reported that for the first time in years, he could see the definition of his ankle bones clearly when he woke up. The mechanism here is purely about creating a path of least resistance for the fluid trapped in your interstitial tissues. Your veins rely on valves to prevent backflow, but as we age, those valves can become less efficient, allowing blood to pool. When you elevate the legs properly, you do not rely solely on those valves. You allow the fluid to drain passively down the slope you have created. This reduces the hydrostatic pressure in the lower legs, which is the force pushing fluid out of the veins and into the surrounding tissue. By lowering this pressure, you allow the tissue to reabsorb the fluid so it can be filtered out. To do this correctly, purchase a dedicated foam leg wedge pillow that is designed to keep your legs elevated without collapsing under the weight. Place it on top of your mattress and ensure that when you lie flat on your back, your heels are clearly elevated above the level of your chest. Your knees should be slightly bent to protect your lower back from strain, but the incline must be steady. Do not use random stack of throw pillows, as they are unstable and will likely shift as you move, ruining the effect. You need a stable, consistent elevation that lasts the entire night. You must be careful if you have certain heart conditions like congestive heart failure, as returning too much fluid to the heart too quickly can sometimes be overwhelming. So check with your cardiologist if you have a heart history. This simple adjustment supports significantly steadier fluid readings and lighter legs by morning. 2. The 2-minute ankle pump. Perform a set of rhythmic ankle flexion exercises while lying in bed, right before you settle down to sleep for the night. This involves pulling your toes firmly toward your shin and then pointing them away from you, repeating this motion in a slow, deliberate cycle. This action is not merely stretching, it is a mechanical activation of the calf muscle pump, which is often called the second heart of the body because of its critical role in returning venous blood from the lower body back to the chest. This movement is essential because your veins do not have a strong pump like the heart to move blood against gravity. They rely on the compression of surrounding muscles to squeeze the vessels. When you are sedentary in bed, that pumping mechanism stops, allowing fluid to sit stagnant in the tissues. By performing these pumps immediately before sleep, you manually flush out the blood and lymph fluid that has pooled in the lower legs during the evening hours. It primes your circulation for the night, ensuring that you aren't starting your sleep cycle with a backlog of fluid in your ankles. I had a patient named Mary, a 68-year-old retired teacher who woke up every morning with ankles so stiff she had to shuffle to the bathroom. She thought this stiffness was just arthritis, but it was actually fluid pressure building up in the joint spaces overnight due to inactivity. Her mistake was going from sitting on the couch directly to lying in bed without any transition to activate her circulation. I instructed her to do these simple pumps every single night. After 1 week, she told me the morning stiffness had reduced by half, and her feet felt lighter and more mobile the moment she stepped out of bed. When you flex your foot upward, the calf muscle stretches and opens the deep veins, allowing them to fill. When you point your toe, the muscle contracts and squeezes those veins, shooting the blood upward. This rhythmic compression acts exactly like a pump, clearing out the venous congestion that contributes to swelling. It also stimulates the lymphatic vessels, which rely heavily on muscle contraction to move lymph fluid. Without this movement, the fluid sits still, becoming thicker and harder to move, which creates that heavy sensation. To perform this, lie flat on your back with your legs straight or slightly elevated on your wedge pillow. Pull your toes toward your nose as far as comfortable, holding for a brief second to feel the stretch in your calf. Then, push your toes away from you as if pressing a gas pedal, feeling the contraction in your calf. Repeat this cycle 30 times at a moderate pace, not too fast, not too slow. Focus on the full range of motion rather than speed, ensuring you feel the muscles working with each repetition. Do not do this so vigorously that you cause a cramp. The goal is repetitive motion, not high-intensity exertion. This actively clears the path for better circulation while you sleep. 3. The sunset fluid cutoff. Establish a strict hydration boundary where you stop consuming large amounts of fluids 2 to 3 hours before your designated bedtime. While staying hydrated is important for overall health, consuming significant water, tea, or other beverages late at night overwhelms your kidneys right as your body is trying to slow down. When you lie down after drinking fluids, your body attempts to process that liquid, but the excess volume often ends up redistributing to the soft tissues of the feet and hands before it can be fully excreted. This timing is critical because it allows your kidneys to process the fluids you drank during the day while you are still upright and active. If you drink a large glass of water right before bed, you are increasing your total blood volume immediately before lying flat. This sudden increase in volume creates internal pressure that forces fluid out of the capillaries and into the spaces between cells, particularly in the lower extremities where gravity has already caused pooling. By setting a cutoff, you lower the overall systemic fluid load your body has to manage during sleep. Robert, a 75-year-old gentleman, came to see me complaining of both swollen feet and interrupted sleep due to needing the bathroom 3 times a night. He believed he was being healthy by drinking a large cup of herbal tea while watching the news at 10 p.m. His mistake was overloading his system too close to sleep, which contributed to his edema and his insomnia. We moved his hydration window earlier, ensuring he hit his water goals by 7 p.m. He reported back that not only did he sleep for longer stretches, but his feet were noticeably less puffy in the mornings. The biological reality is that kidney filtration rates change with your circadian rhythm, and lying down increases the blood flow to the kidneys, prompting them to produce urine. However, if the volume is too high, the filtration process cannot keep up effectively without disrupting your sleep or causing fluid shifts. By stopping intake early, you allow the kidneys to clear the deck before you sleep. This prevents the scenario where your body is holding onto water simply because it hasn't had the time to filter it out before the metabolic slowdown of sleep occurs. To implement this, calculate your bedtime and subtract 3 hours. This is your last call for fluids. Drink the majority of your water in the morning and early afternoon when your metabolism is most active. If you must take medication at night, use only a small sip of water, just enough to swallow the pill. If you feel thirsty out of habit, you can moisten your mouth, but avoid drinking a full glass. It requires a few days of adjustment, but your body will adapt to this new rhythm quickly. Be careful not to dehydrate yourself during the day. You simply want to front-load your intake to the earlier hours. This supports a balanced fluid system without overloading your night. 4. Magnesium-rich evening snack. Eat a small handful of unsalted raw pumpkin seeds about 1 hour before bed to boost your magnesium intake naturally. Magnesium is a vital electrolyte that plays a key role in regulating cellular water balance and maintaining the proper function of the sodium-potassium pumps in your cells. Many seniors are deficient in magnesium, which can lead to water retention because the body struggles to balance the electrolytes that keep fluid inside the cells where it belongs, rather than letting it leak into the tissue spaces. This dietary addition matters because magnesium also acts as a natural muscle relaxant and vasodilator. This means it helps to slightly widen the blood vessels, allowing for smoother blood flow and less resistance in the vascular system. When blood vessels are relaxed, circulation improves, and fluid is less likely to get trapped in the lower extremities. Furthermore, magnesium helps to balance out sodium in the body. If you have too much sodium, you hold water, and magnesium helps the body excrete that excess sodium effectively. I treated a patient named Linda, age 70, who suffered from painful night cramps in her calves along with her ankle swelling. She was taking potassium supplements but seeing no change. Her mistake was missing the magnesium connection, which is often the gatekeeper for other electrolytes functioning correctly. We added a simple snack of pumpkin seeds to her evening routine. Within 2 weeks, she noticed her cramps had virtually disappeared, and the indentation left by her socks on her ankles was significantly less deep than it had been for years. The science is straightforward. Cell membranes rely on magnesium to actively transport ions in and out. If magnesium is low, the cell membrane becomes leaky regarding water balance, contributing to extracellular edema, that puffy feeling in the tissue. By providing a natural, food-based source of magnesium right before the long fast of sleep, you provide your body with the raw materials it needs to maintain cellular integrity and proper fluid distribution throughout the night. It is a gentle, nutritional way to support the mechanical changes you are making. To do this, purchase raw, unsalted pumpkin seeds. Avoid the roasted and salted varieties as the added sodium will defeat the purpose entirely. Measure out about 2 tablespoons, which is a sufficient amount to provide a therapeutic dose without adding too many calories. Chew them thoroughly to aid digestion, perhaps alongside a very small amount of yogurt or applesauce if you have trouble chewing seeds. Make this a consistent part of your nightly wind-down ritual to see the cumulative benefits over time. Do not consume these if you have diverticulitis or explicit instructions from your doctor to avoid small seeds. This supports steadier electrolyte readings and calmer muscles. 5. The cool water shock. Rinse your feet and ankles with cool water for exactly 30 seconds immediately before you dry them off for bed. This is not about freezing your feet with ice, but rather applying water that is noticeably cooler than your body temperature. The cool temperature triggers a natural physiological response called vasoconstriction, where the tiny blood vessels in your skin and superficial tissues narrow slightly. This tightening effect acts like a natural compression stocking, helping to squeeze excess fluid out of the surface tissues and pushing it deeper into the venous system where it can be circulated away. This technique is effective because heat is a vasodilator. It expands blood vessels and allows fluid to leak into surrounding tissues, which is why feet often swell more on hot days or after a warm bath. By ending your day with a cool rinse, you counteract the inflammation and heat accumulation of the day. It sends a signal to the vascular system to tone up and reduce the permeability of the capillaries. This prevents new fluid from leaking out while you sleep and helps move the existing fluid along. It also provides immediate relief to the heavy, throbbing sensation that often accompanies evening swelling. I remember James, an 80-year-old patient who described his feet as feeling hot and tight every night, making it difficult for him to fall asleep. He would soak them in warm water to relax, but his mistake was that the heat was actually increasing the blood flow to the area and worsening the congestion. I advised him to switch to a cool rinse right before bed. He was skeptical, but tried it. At his next visit, he told me the tightness sensation vanished almost instantly after the rinse, allowing him to fall asleep faster, and his feet looked less angry and red in the mornings. The mechanism works by stimulating the smooth muscle lining of your veins. When exposed to cool temperatures, these muscles contract, increasing the pressure within the vein slightly, which helps to propel blood back toward the heart against the residual effects of gravity. It basically locks the door on fluid leakage for the night. Additionally, the cool sensation calms the nerve endings in the skin, reducing the urge to fidget or move your legs due to discomfort, which promotes better rest. To do this, sit on the edge of your bathtub or use a handheld shower head. Run the water over your feet and ankles, adjusting the temperature until it feels crisp and cool, but not painful. Direct the stream over the tops of your feet and around the ankle bones for about 15 seconds per foot. Alternatively, you can submerge your feet in a basin of cool water for the same duration. Dry your feet thoroughly with a towel afterward, paying attention to the spaces between your toes to prevent moisture buildup. Do not use ice water or soak for longer than a minute, especially if you have diabetes or reduced sensation in your feet, as you want to stimulate the vessels, not damage the skin. This supports a calmer vascular response throughout the night. 6. Gentle upward lymphatic massage. Perform a very light, rhythmic massage on your feet and lower legs, stroking specifically in an upward direction toward your heart. This is not a deep tissue massage for sore muscles. It is a superficial technique designed to manually move lymph fluid. The lymphatic system, unlike the blood circulatory system, does not have a central pump. It relies entirely on movement and external pressure to drain fluid. By using your hands to mimic this pressure, you physically push the stagnant fluid out of the tissue spaces and into the lymph vessels where it can be transported away. This action is crucial because lymph fluid is thick and moves slowly. Throughout the day, it settles in the lowest parts of your body. If you simply go to bed without clearing it, that fluid remains static. By spending just a few minutes guiding it upward, you uncork the bottle, so to speak. You are manually clearing the backlog that has accumulated, creating space for normal circulation to resume during the night. It is a way of manually assisting a system that may be sluggish due to age or inactivity. Sarah, a 65-year-old woman, came to me frustrated that her ankles were still puffy despite her daily walks. She mentioned she would rub her feet at night because they ached, but she was rubbing them back and forth randomly. Her mistake was that she was potentially pushing fluid back down into her toes or just moving it around without draining it. I taught her the specific upward-only technique. She reported that the simple change in direction made a profound difference. Her skin felt looser and less stretched by the time she finished the short routine. The anatomy of the lymphatic vessels includes one-way valves similar to veins. When you stroke upward, you push fluid through these valves and they close behind the fluid, preventing it from falling back down. If you rub downward or too hard, you can damage these delicate filaments or simply force fluid against the valves, causing more congestion. The pressure needs to be light. Imagine you are stroking a cat, not kneading dough. You are trying to move the skin over the tissue, not press into the muscle. To perform this, sit comfortably on your bed. Apply a small amount of lotion to your hands to prevent friction. Start at your toes and use the palms of your hands to make long, gentle sweeping strokes up over your foot, across your ankle, and up your calf toward your knee. Always stroke upward, lift your hands, go back to the start, and stroke upward again. Do this for about 2 minutes per leg. Focus on the area around the ankle bone where fluid tends to collect. Do not massage if you have an active infection, a history of blood clots, or if the area is red, hot, and painful to the touch. Consult your doctor first in those cases. This supports steadier lymphatic drainage while you rest. 7. The left side sleeping position. Adopt a sleeping position where you lie primarily on your left side rather than your right side or flat on your back. This specific positioning is anatomical. The largest vein in your body, the inferior vena cava, IVC, runs slightly to the right side of your spine. This massive vessel is responsible for carrying all the deoxygenated blood from your lower body back to your heart. When you sleep on your back, the weight of your abdominal organs can compress this vein. When you sleep on your right side, you are putting the weight of your body directly on top of it. This adjustment matters because compressing the IVC is like stepping on a garden hose. The flow slows down and pressure builds up behind the blockage. This back pressure forces fluid out of the veins and into the tissues of the legs and feet. By rolling onto your left side, you physically lift the weight off this crucial vein, opening up the highway for blood to return to the heart freely. It maximizes the efficiency of your return circulation without you having to do any active work. I advised David, a 78-year-old patient who was a lifelong back sleeper, to try this change. He had chronic swelling that seemed resistant to other interventions. His mistake was mechanical. His sleep position was sabotaging his circulation for 8 hours every night. He used a body pillow to help keep him propped on his left side. It took some getting used to, but he found that not only did his swelling decrease, but he also felt less lightheaded when he stood up in the morning, indicating better overall blood return to his heart. The physiology is simple yet powerful. The vena cava is a low-pressure vessel, meaning it is easily squashed. Relieving that pressure lowers the venous pressure in your legs immediately. This allows the fluid that has been pushed into the tissues to be reabsorbed back into the bloodstream more easily. It is particularly helpful for seniors who may carry a bit of extra weight around the midsection, as that weight contributes to the compression when lying flat. To do this, lie on your left side and place a pillow between your knees to align your hips and prevent lower back strain. You can also hug a pillow against your chest to keep your upper shoulder from collapsing forward. If you cannot stay on your side all night, even starting in this position or spending a portion of the night this way helps relieve the pressure load. It effectively unblocks the main drainage pipe of your body. Do not force this position if you have left shoulder injuries or hip pain that makes it impossible. Comfort is still key for sleep quality. This supports steadier blood flow return to the heart. If you know someone over 50 who could benefit from this, share this video and subscribe for more simple health tips.